And the World Health Organization says the Omicron variant of the coronavirus is spreading faster than the Delta variant and is causing infections in people already vaccinated who have recovered from the COVID-19 disease. WHO Chief Scientist Soumya Swaminathan stated that it would be unwise to conclude from early evidence that Omicron was a milder variant than previous ones. Joining me to discuss this is a virologist, Professor Oyewale Tomori. Thank you so much for joining us on TVC News this hour. Looks like the Omicron variant is really ravaging the world as it is now. Does it look like we've underestimated this COVID-19 so far?
Certainly. Thank you very much. I think we grossly underestimated the problem. Initially, we were saying, oh, it's mild, it doesn't cause. Now we're seeing daily becoming what is becoming. Even the figures we have of Nigeria now, we're looking at 2,000 cases. We don't really know exactly yet whether it is Omicron or Delta. But we get further information, probably likely to be is Omicron that is causing the problem we're having. The figures we have now is about 5 times the peak we had in the third wave. So if we are not careful, we're going to see a more disastrous situation than we have with the third wave.
Well, COVID-19 account for, just like you alluded, account for 50,000 worldwide cases every week. And then the noise has been get vaccinated. Everyone is getting vaccinated, though it may not be as much as it is. But then those who have got 2 jabs, there are reports that they are likely going to be reinfected if they don't ensure safety enough. So why should we even get vaccinated in the first place when you are not certain that this COVID-19 can still kill you at the end of the day, so to speak?
You see, it is the difference between getting infected and dying and getting infected. I mean, getting the vaccinated and not getting hospitalized. Sorry, the whole thing is getting confusing for me. Let me put it this way. Between being vaccinated and not vaccinated, that's the point we're trying to raise. Those who refuse to get vaccinated will get the Omicron and are likely going to get to the hospital and die. But those who are getting the vaccine, you may also be infected, but you're not going to get the severe disease or die. And that's the difference between the two. So when you get vaccinated, you are sure that at least the disease you get is not as severe as those who are not vaccinated. Between death and living.
Well, so talk to me, for instance, who had been vaccinated, had got my first dose, second dose, the importance of taking the booster jab. Is it very sacrosanct that I take the booster jab?
It is important that you take the booster jab because, we're dealing with a situation which, like I said, we're learning on a daily basis. Omicron, when we started, we said it was not going to cause any problem. Now we're seeing it's causing a problem. The booster also helps you to get a higher level of immunity, which gives you a better protection against the Omicron. And therefore, so go for the booster. But I think most important of all, message that we need to pass to people is not just that. It is the fact that continue to wear your mask. Then you are not going to be exposed to any Omicron. Wear your mask, wash your hand. Don't go to all those places where you are likely to get the Omicron. And if you don't get the Omicron, you're not going to get infected. So get your booster, and at the same time, please keep your distance from every other source where Omicron you can be infected by Omicron.
Well, this startling revelation by the WHO about saying more than 3.3 million people have lost their lives to COVID-19 this year, more deaths than what's from HIV, malaria, tuberculosis combined in 2020. And Africa was now facing a steep wave of infections driven largely by the Omicron variant. So what do we need to do so that we don't remain where we are at the end of 2021 by the end of 2022?
Thank you very much. I think you raised a very important point. We are just seeing the coming of Omicron. Many more people are dying. And if we're not careful, many more people will die. So the figures WHO is quoting is just the current pictures. By tomorrow, by next day, it's going to change and increase more and more. So for you and I, for every one of us that is available, please get yourself vaccinated. If you've gotten the 2 before, go for your booster. If you've not been vaccinated before, go for the vaccination. Secondly, keep these non-pharmaceutical interventions because the vaccine is not designed to prevent your infection. You are the one that can prevent infection by wearing your mask. So don't ascribe to the vaccine what it's not supposed to do. The vaccine is to protect you if you get infected. So why do you want to get infected? So go on, wear your mask so that you won't get infected. But if by any chance you get infected, make sure you are vaccinated so that your infection will not become severe disease leading to death.
Well, quickly before I let you go, the WHO DG said that we should try to postpone whatever event that we're having. We should celebrate later. I really can't, put it exactly the way he put it, but he's trying to say that we should be circumspect when it comes to the celebration during this festive season. But a lot of people, a lot of families who are getting back at this time, they will want to hug themselves, they want to marry, they want to, enjoy their season. So what should we be telling them? Should we say they shouldn't go home, or when they meet their family, they shouldn't, welcome them the way they should?
What WHO is saying is that postpone all those things you want to do now that can lead to your getting infected. There are still, God give you life, there'll be more opportunities, more Christmases will come, more New Years will come. If you don't postpone it now, you may not even be there to see the next one. So what the WHO is saying is postpone what you have now. As much as possible, avoid all these things. If you're planning to travel to go and see before, stay where you are. Stay where you are. And that way you are not going to get yourself exposed. There are people now who are telling you that the situation is getting bad and it's getting worse. So stay where you are now, and so that you can have a chance to be alive in the next time when the new year, another new year comes or another Christmas comes. You can go now and enjoy your Christmas now. There's no guarantee that you'll be alive for the next Christmas. So why don't you postpone it and wait so that you have a better chance for the next one that is coming? That's what WHO is saying. Postpone what you are doing now so that you can be alive for other and future things that will come.
I think staying alive is more important than any other thing at this point in time, because that's where the hope actually lies for a lot of people. So, virologist, Professor Oyewale Tomori, thank you so much always for your insight.
It's my pleasure. Thank you very much. Merry Christmas.